Well, speech therapy addresses the communication needs of the individual. We can look at oral motor issues, language issues, articulation, voice stuttering, a variety of different issues.
Bringing a person to their physical potential. Achieving their physical best after they've sustained a birth incident or injury.
Occupational therapy is therapy in which we use treatment to enable a person to become as independent as possible in all areas of daily living. And that would include work and leisure and self-care activities.
I think that love of the child is very, very important and basic to working with this population.
A child's mind is so creative. It's just an absolute delight to listen to them. And if they can't talk, it's still an absolute delight to watch their facial expressions and watch them move. They move so beautifully.
That you do see very nice change in kids. I think naturally you're able to facilitate some nice changes in their communication development.
And every child is so different. And so when you go into a session, you don't know what to expect. And what is very gratifying is coming out of a session and found that the child enjoyed the session, the mother enjoyed the session, you did, and also, more than anything else, all of you learned from that particular session.
You get a chance to interact with children and families on an individual level. And that individual attention brings about change and improvement in the children. And then the parents see that. And it's really wonderful to see how the parents appreciate our assistance.
I chose an outpatient center because it has a lot of flexibility in your schedule.
It is a setting that encourages independence, and it's a setting that encourages the development of individual clinical skills.
Also, you have a close contact with the family, much closer than you have, for instance, in a hospital setup.
Working in this kind of setting, you really get to know each other well. You work with each other in therapy. We're in real close quarters the rest of the time, and I really enjoy the people that I work with.
I do too, and I think that when you do something that's special and a child does something that's special, everyone gets excited. And when you're having an off day, I think everybody feels for you, and it's just that kind of camaraderie that means so much.
We can do pretty much anything that's important to the family of the child, and of course to us. And in a center like ours, we're lucky enough to have the equipment and kind of an open-minded staff and family to do some kind of fun, outrageous things to reach our goals.
You cannot go into a therapy session with a cookbook because the child does exactly what she or he was going to do, whether you had the recipe or not the recipe. So that to me is very challenging and very fascinating.
It was very rewarding because I love children, and it's just a really good feeling to watch children, walk for the first time, crawl for the first time, be able to hold a pencil and do their schoolwork, to see them integrate into their society with other children, and just to see them happy and watch them laugh.
I think kids are very naturally honest about things, and when they realize they've done something they haven't been able to do before, there's just such honest emotion and excitement about that, and I think immediately you just feel that same sense with them.
If you're not willing to play with kids, you're not going to get anywhere with them.
Children learn about life through playing.
I don't carry a briefcase, I carry toys around.
Well, we play with toys.
Lots and lots of toys.
I love toys.
It's an environment that's very nurturing, and I like that. It's one of the reasons why I think I've stayed here, is there's a sense of nurturance about the center and about pediatric outpatient rehab in general.
Above all, I think I like the fact that you've got independence. And that independence is very valuable for those people who want to always be innovative, who are very self-directed, and who also want to move up.
there's camaraderie, there's a depth of friendship that develops working in pediatrics.